formally.
Very good morning to all of you. I'm Vivek Singh Malik and I'm scientist at the center. So greetings from PGMA Chandigarh in collaboration with ICO India. Today's session will be taken by Dr. Kaustubh Bora. So ma'am, can you please?
Yes, welcome Dr. Kaustubh Bora. We're very nice to have you. Dr. Kaustubh Bora is the scientist at RMRC Dibrugarh and of the ICMR. And he has been actively involved in doing systematic reviews with us. And also now he's going to start mentoring people how to do systematic reviews in the Northeastern region. So welcome, Dr. Kaustubh. We're looking forward to your talk on how to write a protocol for a systematic review. Dr. Kaustubh, please.
Thank you, madam. It's a pleasure to be with you, and I thank you for this opportunity to present this talk. So, Vivek, can we start?
Yes, you can start. You can share your screen.
So I'll be switching off the video during the talk so as to preserve the bandwidth. And
yes, it's visible, Dr. Kaustubh.
Is it visible?
Yes, it's visible.
And I believe I'm audible, Dr. Vivek?
Yes, you are audible.
Okay.
You can start. Yes, it's visible and audible.
Okay. So very good morning, everyone. I have been made to understand that under this capacity building program, the participants have undergone and they will be undergoing a number of lectures and modules on evidence-based medicine. So today's session will be an introductory one, where I will be providing an introduction to systematic reviews, and also I'll be speaking on how to write a protocol for a systematic review. There will be dedicated sessions on different aspects of systematic review in the subsequent weeks by different speakers. So today's talk, I have divided it into two parts. In the first part, I'll be providing an overview of systematic reviews. In the second part, we'll discuss how to write a protocol for a systematic review. So beginning with the first part, what do we understand by a systematic review? There are a number of definitions. There is one which says that a systematic review attempts to collate all empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question. It uses explicit systematic methods that are selected with a view to minimizing bias, thus providing more reliable findings from which conclusions can be drawn and decisions are made. Now, there are a number of definitions, and let us for the moment forget these long definitions and try to understand what systematic review means in essence. Now, there are some key terms, some catchphrases that we need to be familiar with when we are dealing with systematic reviews. Like, for example, there has to be a specific research question. Some pre-specified criteria are required. The methods that we plan to use must be systematic. There is a component of literature search where eligible studies are identified, which are critically appraised, the information from which is synthesis, in a way that bias is minimized and reliable findings are obtained. So these constitute the core of a systematic review. There is another term that we frequently hear in relation to systematic review, that is meta-analysis. So meta-analysis is when we employ statistical techniques to understand and summarize the results of individual studies in a systematic review. So essentially, a meta-analysis is a type of a secondary data analysis. There are different types of systematic reviews, like intervention reviews, and diagnostic test accuracy reviews, methodology reviews, qualitative reviews, and prognosis reviews. These reviews are published by the Cochrane database of systematic reviews. And in addition, there are some other reviews also, like prevalence or incidence reviews, etiology or risk factor reviews, cost and economic evaluation reviews, and so on. Now, this brings us to the question, why do we need to do a systematic review at the first place? Often it happens that for a particular topic of our interest, there are numerous publications which are contradictory. This is a very common situation, right? And what do we do in such a case? In such a case, we can carry out a systematic review as an evidence-based method for minimizing the bias and clearing the confusion. Not only that, it facilitates rational decision making and also policy decisions. Consider this example that there is a treatment for a particular disease and we want to know if it is effective or not. What do? We look into the research studies. We see that there are some studies that say that the treatment is effective. It is also likely that there will be studies saying that the treatment is not that effective. So how do we decide in such a case? So that is when we can carry out a systematic review. We can combine all the studies that are available together. We can extract the information out of them, pool them together, and then come up with a coherent result, a coherent finding, based upon which we can take a decision. Systematic reviews also help in revealing gaps in existing knowledge. So they help in identifying future research areas and act as precursor to primary studies. They avoid redundancy as well. So in the evidence pyramid, if we look at the hierarchy of evidence, we'll see that meta-analysis and systematic reviews are placed high up. They're placed higher up towards the top of the pyramid. That is because the evidence that they provide is high quality. It's top-notch, based upon which clinical practice guidelines and recommendations are made. That also brings us to the question that why cannot we do a traditional review? How is it different from a systematic review? Now in this table, I have tried to show the major differences. Traditional reviews, as we can see, they try to gain a broader understanding of things. And there is often no clearly defined path for carrying out the review. The identification and selection of studies is often purposive and selective. It is based on the reviewer's discretion. And even the assessment of the quality of the various studies that are included and the analysis and reporting is subjective. It depends upon the reviewer's opinion. Now, this is very different from what we do in a systematic review, where in every step, be it the structure or the organization, the methods, the analysis or the documentation and reporting, in every step, there is rigor involved. And there is a systematic approach ingrained, as we will see in the subsequent slides. So these are the main steps in a systematic review. It starts with formulating the research question, followed by literature search, data extraction, critical appraisal, data synthesis, and reporting of findings. There are a number of sub-steps as well. Some of these steps, like formulating the research question and searching the literature, have been covered during previous lectures. And some others, like data extraction, critical appraisal, and data synthesis, will be covered by the subsequent lectures. So I'll be going through these steps very briefly. The first step is formulating the research question. This step is very important because it sets the direction in which the entire review is going to proceed. The research question has to be very focused, and we can take help from the PICO framework, where P means the patient or the population of interest, I is the intervention or the indicator. It can be a diagnostic test, it can be a treatment, a management strategy that we are interested in. C is the control against which the intervention is evaluated, and O is the outcome, the various consequences of the intervention. And sometimes there is a suffix T when PICO becomes PICOT, and T here means the time duration. This is an example of a research question using the PICOT framework. In adult patients with total hip replacements, how effective is painkiller compared to aerobics in controlling pain during the perioperative period? Now, if you look at this research question, there are a number of components to it. The adult patients with total hip replacement is the population of our interest. Painkiller is the intervention that we are interested in, which we want to evaluate, against aerobics, which is the comparator. And the outcome is the control of pain. And time period here is the duration during the perioperative period. There are other frameworks also for formulating a research question, like the SPICE framework, which is useful in social sciences, and the SPIDER framework, which is useful for qualitative studies. The next step is searching the literature. The literature search has to be systematic, and it should include the components of the PICO question. I'm sure you have been introduced to databases like PubMed, Embase, Web of Science, etc., and also other sources, including gray literature, to ensure that the search is as comprehensive as possible. You're also aware of mesh terms and empty terms and Boolean operators like and, or, and not, which can help in stitching together the systematic search strategy. And of course, we have reference management softwares like Mendeley, EndNote, and Zotero, which can make life easier while dealing with the various references, the various studies. Now, when we carry out the literature search, it can be either sensitive or specific. Both have their merits and demerits. In a sensitive search, the search is wide. It covers a large part of the literature, but it is also likely to include a large amount of irrelevant hits. On the other hand, a specific search is narrow, but it has greater accuracy. So which of these two strategies should we follow? Should we carry out a sensitive search or a specific search? Now, for systematic reviews, it is advised that the search strategy should be sensitive. We try to keep the search as wide as possible so that it is as exhaustive and as comprehensive as possible, and no potentially eligible study is missed out. Of course, the search will also include a large number of results which are irrelevant, but then we can deal with these at a later stage. But to begin with, we do not want to compromise on any potentially eligible studies for the review. So it should be sensitive. Then we have this step of data extraction, where the search results are filtered and the eligible studies are shortlisted. First, we do a title and an abstract screening, followed by in-depth reading of the articles. The irrelevant results are removed, duplicates are removed, and the relevant details, only the relevant details are extracted. So it depends upon the research question, which statistic, which measure is of interest to us. Do we want to focus on the odds ratio or the attributable risk or the hazard ratio and so on. So only the relevant details are extracted. But sometimes it so happens that additional calculations are required for the reviewer. For example, for transforming some amount of data like converting standard error to standard deviation, or for calculating frequencies from counts and so on. And it is always a good idea to use data extraction sheets and softwares and do a pilot trial of the data extraction sheets. The next step is the critical appraisal step. This is a very crucial step. The systematic review is as good as the studies that are selected for the review. Now we can appreciate that all studies are not equivalent, right? Some studies are good, some are not so good, some are biased, some are not so biased, and therefore we cannot treat all the studies equally. And this step helps in distinguishing these differences and also for judging the study for what it is. There are critical appraisal tools which are domain-based, like, for example, there is a tool known as the risk of bias tool or the ROB2 tool. It is provided by the Cochrane Collaboration and is useful for interventional studies. Using this tool, the studies included in a systematic review can be classified as having a low risk or an unclear risk or a high risk of having bias. Similarly, for diagnostic accuracy studies, there is a tool known as QUADAS tool. It is provided by the University of Bristol. Now, again, I'm not going into the details of these individual tools because there will be dedicated lectures on these. There is something also known as the assessment of multiple systematic reviews, or the MSTAR2 tool. Now, the MSTAR consists of a checklist of 16 questions, which may be answered by a yes, partial yes, no, or no meta-analysis conducted. These 4 types of responses. And based upon these 4 responses, the methodological quality of the systematic review can be assessed and classified as either high quality, moderate quality, low quality, or critically low quality. This is followed by the data synthesis step, where results from different studies are combined. Statistical techniques can be used, doing a meta-analysis. Sometimes statistical techniques may not be applicable, and then we carry out a narrative synthesis. And for qualitative studies, we may be required to do a qualitative synthesis. Softwares available, RevMens, Theta, these help in carrying out systematic reviews. The data analysis part. And the data analysis part actually has a lot of activities. We need to decide upon which model we want to adopt, whether the fixed effects model or the random effects model, construction of forest plots, test for heterogeneity using tests like eyeballing or Cochrane Q. Then we have to detect potential confounders or effect modifiers by subgroup analysis. We also have to look for publication bias. So a number of steps are involved in the data synthesis step. Simply synthesizing the data is also not sufficient. Once the data is synthesized, it is important to assess the quality of the evidence that is generated. And this can be done by using the grade approach. Grade stands for grading of recommendations, assessment, development, and evaluation. Grade helps in offering ratings. Depending upon the grade approach, the systematic review can be rated. The evidence that is generated by systematic review can be rated as very low, low, moderate, and high. And depending upon these ratings, we can decide upon what kind of recommendations to make for practical use, for clinical use. And these are usually presented in a summary of findings table. After the data is synthesized, we report the findings, we publish the findings, and this step also needs to be has to be in a systematic way. Reporting guidelines are there, provided by the Equator Network. And for reporting systematic reviews, the PRISMA guidelines are followed. PRISMA stands for Preferred Reporting Items for Systematic Review and Meta-Analysis Protocols. It helps in assessing the quality of reporting of a systematic review. So the PRISMA guidelines have undergone a number of modifications over the years. The latest ones that is available now is the PRISMA 2020 guidelines, which were released just a few months back. In these guidelines, you will see there is a checklist of 27 items. Right from the title of the systematic review up till the other information like the discussion, the results, the availability of data, code and other materials, each and every possible step under the systematic review needs to be documented as per the PRISMA checklist. So when we are done with the systematic review and when we plan to report our findings, when we plan to publish our findings, following this PRISMA checklist helps in forwarding our results in a very systematic manner. And it also ensures that none of these steps are missed. Sometimes it is required to repeat the systematic review. With new literature available, it may be necessary to carry out the systematic review again and to update it. So that was the first part. Coming to the second part of the talk, how do we write a protocol of a systematic review? So what is a systematic review protocol? The protocol describes the proposed approach for a systematic review. They outline the question that the review authors are addressing, detailing the criteria against which studies will be assessed for inclusion in the review, and describing how the authors will manage the review process. Protocols contain information that define the health problem and the intervention under investigation, how benefits and harms will be measured, and the study design. The protocol also outlines the process for identifying, assessing, and summarizing studies in the review. So I would like to take you back to this previous slide where we had compared traditional reviews and systematic reviews. So there was this step there where I said that in a traditional review, there is no clearly defined path for carrying out the review, unlike in a systematic review. And that is where the role of protocol comes in. The protocol, it sets the plan, it sets the path which has to be followed for carrying out the review. And this sets it aside from a traditional review. So why is the protocol important? It acts like a roadmap. It describes explicitly the rationale, the hypotheses and methods that are planned to be used in the review. And very importantly, all these descriptions have to be provided in advance. These descriptions are prospective in nature. They have to be provided a priori so as to ensure transparency and also to promote research integrity. The protocol should include the research question or the objective, the inclusion-exclusion criteria, the databases to be searched, the search strategy, the methodology for data extraction and analysis, declaration of interest, the time frame, everything, every step, every way in which this systematic review is being planned has to be covered by the protocol. Now, when do we develop the protocol? Remember, these are the steps while carrying out a systematic review. So the protocol development or the protocol writing phase is carried out after formulating the research question. But it should be always before carrying out the search, before the review is actually started. So for preparing the protocol also, there are guidelines. I've already mentioned about PRISMA guidelines for reporting systematic reviews. Similarly, for reporting protocol, there is another set of guidelines based upon the PRISMA framework, which is known as PRISMA P. These were reported in 2015, and there are companion papers available. These are very user-friendly and easy to understand. So this PRISMA P checklist also has a number of items that are to be addressed while writing the protocol. If you have a look here, it starts from the title, the details about the authors, what will be the contribution of the individual authors, the sources of support, sponsors, rationale, objectives, eligibility criteria, information sources, search strategy, data management, selection process, data collection process, data items, outcomes, risk of bias, data synthesis, meta biases, and confidence in cumulative evidence. So it's a very comprehensive checklist, a checklist of 17 items. And while preparing the protocol, each of these items under these headings have to be addressed, so as to ensure that the review that would be carried out will be transparent without any biases. So once the protocol is prepared using the PRISMA P checklist, what do we do next? The next step is the registration of the review protocol. And for registration, there are dedicated registries, the most popular of which is the Prospero registry that is hosted by University of York. It is a database of systematic review protocols, which help in registration of protocols freely. No costs are involved. So registration of protocols is also a way of staking one's claim. So that is also a reason why we should register our protocols. Not only that, these registries have a search function also, using which we can look up different systematic reviews that are already being registered. So that helps in preventing duplication of work. So for registration of the review protocol, there are guidelines available from Prospero. Now, I don't know if this slide here is visible to you or not, but this guidelines document, it has a set of 19 items from the review title to the review methods. That would be, sorry, 39 items to the various kind of information in relation to the systematic review, which would be included and which have to be provided at the time of registering for the protocol. Now, this Prospero template is very much similar to the PRISMA P template if you go through the individual items. This is a very interesting paper by Chang and Slutsy. It was published in the Systematic Reviews. I would encourage the participants to go through this commentary. It debunks the common myths about protocol registration, what are the various steps involved, and so on. Now, a question arises that suppose we have prepared the protocol, we have registered it. In the future, if we feel that there is a need for modifying it, can we modify it or not? Now, modifications should not be made because of an awareness of the results of individual studies. It should not be that we think that including certain studies would alter our results and therefore we modify the protocol. It should not be that. But if there is a genuine need to modify the protocol because of a clearer understanding of the review question, then the protocols can be modified. And PRISMA P checklist allows modification. You can see here, there is a section for amendments where the modifications can be included in the protocol. But these modifications have to be documented and they have to be justified. In addition, there are some other protocol related resources, like there is the Messir manual, and registries also, other registries are available, like Campbell Collaboration Registry, the Cochrane Collaboration Registry. We have been coming across this term Cochrane a number of times, right? So any discussion on systematic reviews is incomplete without Cochrane. Cochrane is a British international charitable organization. Previously, it was called the Cochrane Collaboration. It was founded in 1993 under Ian Chambers. It was developed in response to Archie Cochrane's call for up-to-date systematic reviews of all relevant randomized controlled trials in the field of healthcare. And Cochrane has 3 goals: to produce trusted evidence, to advocate for evidence, and to inform health and care decisions. Now, this is a picture of Sir Archibald C. Cochrane. He has written an autobiography of his journey in systematic reviews and evidence-based medicine. This is a picture of Sir Ian Chambers. And this is the logo of the Cochrane Collaboration, where you can see in the center, there is the forest plot. Now, the Cochrane provides a number of useful resources for learners, a number of learning resources, and these are mostly free of cost. It offers a number of training programs. It also offers a number of guides and handbooks to familiarize newcomers with systematic reviews and meta-analysis, and these are very easy to follow, very user-friendly. I would encourage the participants to visit these resources. Then there is the Cochrane Library, which is a collection of databases that contain different types of high-quality independent evidence. And at the center of the Cochrane Library is the Cochrane Database of Systematic Reviews, which is a leading journal and database for systematic reviews. Then there is also a registry for controlled trials, the central registry. And then there is a dedicated software as well for carrying out systematic reviews, the RevMan software. Now, before we conclude, let us see what is the scenario of systematic reviews globally and in the Indian context. This is a very recent paper. It is still in press ahead of print, which was published in Journal of Clinical Epidemiology, which says that during the 2000 to 2019 period, this period of 2 decades, nearly 80 systematic reviews were published every day. Such is the popularity of systematic reviews, and such is the importance that people are realizing it now. This is a slightly older paper in the American Journal of Sports Medicine, where they saw that from 1993 to 2011, how exponentially the number of systematic reviews and meta-analysis had increased. This is a more recent paper in systematic reviews, which shows publishing trends from different countries. Here, if we see, this is for systematic reviews and this is for meta-analysis. From 1995 to 2015, there has been a very sharp increase in the number of systematic reviews as well as meta-analysis over the years. And these are the top 10 countries for systematic reviews. USA tops the list. For meta-analysis, China tops the list. And this will be more clear when we look at this picture. This is data from 2015, where this column shows the countries. This shows the various publication types. If we see our country, India, here, for all publication types, in terms of the number of publications, our position is 10th. But in terms of systematic review or meta-analysis, we are way behind. 17 for systematic reviews and meta-analysis for, and 20 for meta-analysis. And China, on the other hand, we can see they are the leaders for meta-analysis. They are the top country for systematic reviews. They are the third ranking country. So it's high time that we do something about it and we carry out more systematic reviews and reverse this trend. So this is a small animation which shows how the systematic review processes, right from clearing out, selecting the various studies to generation of data, synthesis of data, forming a funnel plot, forming a forest plot. So that is all. Thank you so much for your attention. Teamwork is very important for systematic review. We learn together, we collaborate, and it's not possible for a single person to carry out a systematic review. Teamwork is mandatory. Thank you so much.
Thank you very much, Dr. Kaustubh, for an excellent talk.